Are you tired of dealing with the hassles of insurance and all the paperwork, sometimes not getting paid, and you're getting paid less than you were in the past, perhaps? Or maybe you already have a cash-based practice, but you would like to have more patients, more new patients come into the practice. So you're definitely in the right place. We're going to talk about the 3 ways to get more cash patients into your practice. This is Chen Yen, your 6 and 7 figure practice makeover mentor at introvertedvisionary.com, and I'm your host today for the ChiroSecure Show. So let's talk about what are those 3 ways so you can use them right away in your practice to start bringing in patients you enjoy working with, where you don't have to have these headaches of insurance. So as we do that, I'd like for you to type in the chat below, are you currently a cash-based practice fully, or do you still accept insurance? Go ahead and type that in the chat below. So number 1 way is, how are you to bring more cash patients in the door, is looking at, well, how are you actually educating your patients about your cash services in the practice? For example, it's amazing to me even, for example, when I went to a chiropractic office once myself, it was I went for more of a facial there because they had those services. They also had massage. They also had some other service offerings, which I didn't really know about. And then they had the chiropractic side. And what I noticed about this was I kind of heard about the other parts of the practice, but I didn't really understand the different service offerings. And yet I've been to this place more than a few times, right? And so this happens quite often. As I've talked to many chiropractors, many times they'll bring up how they have other services like nutrition, spinal decompression, or other kinds of cash-based services within the practice. And then when I ask them, well, how are you letting people know about these other services? What is your specific approach for doing that? And usually what I hear is that there isn't a specific approach to educating patients about those services. So that's the first question I would ask yourself with that. And so is there area of opportunity to let your patients know more about those offerings? So how can you let them know in such a way that they actually would want to pay you for those services? And that way you don't hear that, oh, I can't afford it, or, oh, that's out of pocket. Oh, I don't think I can do that, right? So here is one framework from the Consistent Patients Formula for Introverts. This comes from our Consistent Patients Makeover Mentorship for Introverts. And this is how you can bring it up. You can say, first, you could talk about what are the frustrations or challenges with that particular health issue they're experiencing. Then you can bring up, what is the current approach of addressing those issues? And what have been the shortfalls? So think about the conventional approach to addressing that particular health issue. What are some of the shortfalls of that, and bring that up. Then bring up what's missing about that approach. In terms of what related to the shortfall, what are some things that are missing, perhaps clinically, that could be of benefit to the patient? And finally, then bring up how to actually have this happen more, how to get to the desired outcome through your approach, in a more how your approach would help support that, whether it's a good adjunct, whether it's actually more effective, whether it is longer lasting, whether it could actually take less time to heal. So whatever it is that your approach can really help people with, to explain it in that way. So that's one helpful framework of how to talk to your patients so they actually understand that how you can. Dying and dead, and I'm on live right now. Battery,
Jen will be right back. We're having some technical difficulties. Please hang in.
So the second way to bring in more cash patients is a tactical approach in terms of bringing in new patients into your practice. And we're going to talk about that also with a third way as well. And so the second way is, and by the way, before we get into this tactical approach, I also want to say that in terms of you having your patients take you up on your cash-based services, then you also need to have a good way of addressing different concerns, like, oh, I want to do this, but I can't afford it. So what kind of, what do you say to that? So that they don't just, your patients don't just bring that up and then not move forward with care, even though it could be beneficial for them. So if you'd like that in terms of what to actually say and a script for that, that's been working well for our chiropractor clients, and feel free to just private message us, and then happy to give that to you. So for listening to this right now, so you can private message us or comment below that you want it, and then we'll reach out to you and give it to you. Or you could go to introvertedvisionary.com and then go to the about and then the contact page, and then request it from us. Happy to give it to you. Okay, so the tactical ways. Let's talk about second way to get more cash patients into the practice. So one reason why not as many cash patients are coming in yet is because they don't really understand how you can help them. And if they also see that what you offer is similar to another chiropractor who covers things through insurance, then there's just could be less of a reason to come to you. So how can you actually educate people about the benefits of your cash-based services and have them see you as the go-to chiropractor in your area, where it's like you are the one people will want to go see because you're the best, or you are just really good at doing this particular thing, right? Whatever the cash-based services are. So in order to do that, you might think, well, okay, how do I get the word out? So you might think, maybe I should do ads. Maybe I should go network with people. But all those things, even if you do them well, it still doesn't help you get seen as a go-to chiropractor. It's still you. It's almost like you going out there and saying, hey, I'm here, kind of thing, right? Like with ads and with networking. So one avenue to help you get seen in a different limelight as an expert, as a go-to clinic in your area, is to educate through speaking. And so, because when you are able to actually educate patients, and when they also get to experience you to see if they resonate with you, they're more likely to decide that they want to work with you because they feel connected to you, and be willing to pay cash as well when they really understand the benefits of what you offer versus someone else who accepts insurance. So during these times, what's really cool is, because some of you might have spoken before, you might have done talks in person, some of you may not have done it ever. And what is really cool right now is that people are more open to learning about things online. So you could be doing these things virtually. You don't even have to leave the house. So for example, you could actually just do one webinar to educate people about what you have to offer. But how do you actually get people to attend it? One great way to actually have people attend it is by you speaking in front of different kinds of organizations. So you don't have to spend the time or the energy trying to get people to show up to your webinar, but rather you can automatically get seen as a go-to chiropractor, as an expert when you are speaking, because they're hosting you. So we just need to get your foot in the door in front of those opportunities to be speaking. So as a matter of fact, I just had a client of ours do that this past week, and she did a talk. It was in front of a small audience, actually. It was like 10 people, and she had like 3 people sign up for her cash-based services that were over $1,600. So not bad for hopping on for a half-hour webinar, right? So then you just need to have you just need a couple key things. You need, one, a talk that not only educates and not only educates, but also inspires new patients to come from it, because it's a different skill set to just be educating and lecturing, that kind of thing, versus to educate and also inspire new patients to come from it. So you just need one talk. You don't need like 10 or 5 or even 2. You just need one talk that you can give over and over again that brings in patients. Also, once it's actually working, you could actually put on autopilot. That's the cool thing. It can be automated. So even when you're eating, even when you're sleeping, even when you're spending time with your family and your kids and your friends, that webinar is doing the talking for you and bringing those patients in the door. So that's one avenue that can help you with bringing in more cash patients. You can go to our website also. There's additional training about that, free training about how our clients have been getting anywhere between 10 and 26 new patients a month through speaking virtually, and go to introvertedvisionary.com. Okay, so third tactical tip is to look at one under-tapped avenue of bring cash patients in the door. What is it? It's also really good even if you still accept insurance. And it's an approach that it's one of those few approaches where you could put it in place once and be getting referrals for years to come, like new patients for years to come. What is it? Is to actually receive referrals from medical doctors or other practitioners, other holistic practitioners. It doesn't even have to be medical doctors, for those of you who are kind of concerned about, well, medical doctors won't refer. But in any case, medical doctors, they actually have thousands of patients in their practices, and many would be willing to refer if they actually knew about you and if they trusted in how you can help them. So having come from the experience of having worked with many medical doctors in my career, I've worked in the outpatient setting, hospital setting. I've been behind the scenes of the FDA and at Merck. I've seen what actually gets doctors to want to refer and what doesn't. So it can really give you the shortcuts to that, as we have been doing for our chiropractor clients. So as far as imagine even if you had 3 MDs sending you 1 or 2 referrals a week. What would that do for your practice? And you don't actually need that many referrals. You just need a couple of MDs who are your biggest champions. But then, some of you might be thinking, well, I don't know that they will refer. They're kind of skeptical about chiropractic, or maybe they see me as competition, so they're not going to refer. So here's the thing. Most medical doctors are also looking after what can be beneficial for their patients. They're also looking for bettering outcomes of their patients. Is everyone going to refer? No. Unfortunately, not every medical doctor believes in chiropractic. But that's exactly why it's up to you to educate them, because if not you, then who? And also, you still don't need that many medical doctors to refer, right? We worked out the numbers earlier. If you had 3 providers sending you 1 or 2 referrals a week, or even 2 providers sending you 1 or 2 referrals a week, that adds up, doesn't it? And so one important thing is how you're communicating the efficacy as well as the safety. Because many times, one reason, in order to get more referrals from medical doctors, you need to understand why you might not be getting as many referrals as you could be. One reason why you may not be getting as many referrals as you could be is because of their concern for safety. And they're concerned about lawsuits these days. So if they refer to you and they don't really understand too much about it, and then it's harmful for the patient and it goes back on them, then they're really concerned. So how are you approaching them to help them feel comfortable? So this is one of the mistakes that a lot of chiropractors make when wanting to develop relationships with medical doctors, is not really having a strategy or plan. It's just like, oh, let me just reach out. And then, oh, I build a good connection. Oh, they should start referring. But how's that worked before? And so if you actually had more of a plan, like what being prepared first, who to actually reach out to. So for those of you who feel like you're concerned that MDs won't refer, you could reach out to MDs who have concierge-based practices, who already have cash-based practices. And that way their patients are used to also paying out of pocket. And the medical doctor is also many times could be also more open-minded about things too, right? So that's the first step, deciding who to actually reach out to. And remember that you can also reach out to nurse practitioners or PAs. For example, we have clients who are nurses and nurse practitioners, and they say, hey, don't forget about us. We're actually easier to get in with than medical doctors. So don't limit yourself to medical doctors. There are all kinds of practitioners who could be referring people to you, or even acupuncturists or naturopathic doctors. So that's the first step, is to decide who would make the most sense to develop a relationship with. Then the next step is to then reach out. Like, how are you going to get past the gatekeepers? How do you approach doctors? And when you actually do end up having that opportunity to connect. And then number 3, how are you progressing things forward so that you start getting referrals sooner rather than later? That way you're not in a place where you feel like it went well, but you're still wondering, when are they going to start referring? It's been like a week, it's been a month, nothing's really happening, right? So really having system in place that support that. And these are things that are part of our consistent patients formula for introverts that our clients tap into and plug into to get those doctor referrals happening sooner rather than later. And so for those of you who would like a head start on this as far as your first step towards getting more doctor referrals or be getting more cash patients through educating and speaking, but you're not really sure how to go about it, then feel free to go to introvertedvisionary.com. Check out our free trainings, and then I'll help you, we'll help take this further for you. And for those of you who are in a place where you feel like you're at a plateau and you just know you're capable of so much more, and you would like to be making a good income while helping more people, because that just makes you feel good, and you really want to have a practice you're proud of, then feel free to also go to introvertedvisionary.com and then book in for a free chat with us, and happy to see how we can help you grow faster. And for next week, stay tuned to Dr. Walter Sanchez's show. So with that, see you soon, and go to introvertedvisionary.com to take this further.